In Somalia, it is not only the elderly who suffer from blindness. The young are also affected. In a country that has been plagued by violence and conflict for decades, with little or no quality medical services and only a small number of qualified doctors and nurses, preventable and treatable eye problems can quickly develop into complete loss of sight. In Galcayo, northern Somalia, a surgeon born and raised in Mogadishu, who is now based in the UK, has returned to his country to perform life-changing eye surgeries. Supported by the international medical organization Médecins Sans Frontières, or MSF, Dr. Abdirisak Dalmar and his team will perform hundreds of operations during the 10-day visit.
We are here in Galcayo South Hospital, which is a hospital run and managed by MSF. And we are here to conduct an eye camp and to help eye patients. And this eye camp is divided into two phases. The first phase is called screening and treatment of medically manageable eye diseases. The second phase is the surgical phase.
For many Somalis, life is a daily struggle. If you are blind, that struggle becomes even harder. You cannot go to school or work and earn a living. You cannot help your family. Abdi Nasir Mohammed Ibrahim is 21 years old. 8 months ago, he was in an accident and lost his sight in his right eye. Because of this, he was no longer able to farm and provide for his family. He has traveled for over 14 hours to come for this surgery. After being screened by the doctors, he is given an appointment for his operation. The surgery itself takes only 20 minutes. The opaque or cloudy lens that is inhibiting Abdi's vision is removed and replaced with an artificial, transparent intraocular lens which will give him back his sight. The following day, Abdi must come back for a checkup, and then he can go home. The work is exhausting. The team starts every day at 5 a.m. and often does not finish until 10 p.m. so that they can meet the huge demand for surgery.
And this eye camp, it really served a lot of people that really traveled from all over Somalia. Majority of them came either from Mudug region, which is where Galcayo is situated, but they also traveled from Puntland regions, from Somaliland, from south of Somalia, and from the Somali zone of Ethiopia. We have seen patients that flew from Mogadishu just to have the surgery. And that is really explains the lack of services and the eagerness of people really to benefit from this valuable service.
For Dr. Dalmar and the MSF team, the long days are worth it. A 20-minute operation can change someone's life forever.